You ever wonder why some kids snore like tiny chainsaws? Well, in many cases, the culprit is adenotonsillar hypertrophy, the most common cause of pediatric obstructive sleep apnea, OSA. So, here's what happens. As the tonsils and adenoids enlarge, often due to recurrent infections or just normal childhood growth, they start blocking the upper airway, especially during sleep when muscle tone decreases. This leads to intermittent hypoxia, fragmented sleep, and increased work of breathing. Now, why does this matter? Well, untreated OSA in kids isn't just about bad sleep. It can lead to neurocognitive impairment, behavioral issues like ADHD, poor academic performance, and even cardiovascular consequences like pulmonary hypertension if severe. Clinically, parents often report snoring, gasping, restless sleep, and even bedwetting. In more severe cases, kids might develop failure to thrive or excessive daytime sleepiness, though the latter is more common in adults. The gold standard for diagnosis? Polysomnography. But in clear-cut cases, think a 6-year-old with massive tonsils and classic symptoms. A thorough history and physical exam might be enough to proceed with treatment. And speaking of treatment, adenotonsillectomy is the first-line intervention. It's highly effective, resolving OSA in up to 80% of cases. However, in children with obesity or craniofacial anomalies, residual OSA can persist, requiring additional interventions like CPAP or weight management. Bottom line, if a child has significant snoring, gasping, or behavioral concerns, think OSA. And if they have big tonsils, adenotonsillectomy is likely the solution.